Sorry for the background noise. My kids don't want to get in the bath. I'm sorry, go ahead.
Okay, welcome. Good evening, everybody. Thank you for joining us for another Tuesday Town Hall with Monique Smith, candidate for Ohio State Representative. I'm Carolyn Kane, I'm your moderator for tonight. Tonight we are going to talk about healthcare in Ohio and how we can work together to keep Ohio's families safe and healthy. So we are so happy to be joined tonight by Casey Weinstein. And he is a veteran and a businessman who's been the state representative for the 37th district of the Ohio House of Representatives since 2018, and previously served on the Hudson City Council. So welcome, Casey.
I'm excited to be here. Thank you, Carolyn and Monique.
And Monique Smith is our host for tonight. She's the candidate for Ohio House District 16. She brings her background in business, community service, her experience as an elected official. Welcome, Monique.
Hello, this is exciting. Thank you for doing this, Casey.
I'm excited to be here. I appreciate it.
And I'm excited. I think both of you can bring some great perspectives tonight, especially you're both parents. You have kids and you're navigating this in that way as well. So I think that gives us all a pretty different perspective on things and how that affects everybody. But, you know, the health of all Ohioans is important. And so I'm really excited to have this discussion. I think this is top of mind for just about everybody. But before, I'm going to have Monique ask you some questions, Casey. Before I turn that over to her, I first want to let everybody out in Facebook know that we are accepting questions via the chat. So if you want to ask a question to Monique or Casey or both, please put that in the chat. And then I also want to ask you just to talk a little bit, both of you, what you see maybe are some similarities between your districts. So Monique is running for House District 16, which is the western suburbs of Cleveland. And Casey, your House District 37 is the Akron area. Am I right?
Yeah, Northeast Summit County. So yeah, sort of in between both worlds of Cleveland and Akron, but closer to downtown Akron.
Okay, so what do you think the similarities are, or even some of the differences that might affect, you know, how you are looking at things when you're in Columbus?
Well, Casey, why don't I first, let me tell you a little bit about the landscape over here.
Yeah.
And that'll give you a little more to maybe help you visualize. But we have just 5 cities all in Cuyahoga County in my district. They're the cities of Rocky River, Bay Village, Westlake, North Olmsted, and Fairview Park. A couple of them are right on the lake. And then a couple, you know, the other 3 progressively move a little bit south. And, you know, we have a mix of, I think, some different income levels. But overall, folks in our district tend to, you know, I'd say, I don't know, almost a third have more than a high school education. Almost a third maybe have like right around a high school education. It's an interesting mix. And we have folks who work in labor and folks who work on the front lines in healthcare. And we have some top ranked public school systems. And so anyway, that's kind of a little bit of the mix over here. Does any of that sound sort of similar to what you have going on over in your district?
Yeah, like if Ohio is a microcosm of America, right, then, you know, it sounds kind of like our districts are sort of microcosms of Ohio, where you've got a little bit of everything going on there, which I think is great. I mean, there's different cities, each of them sort of is distinct and has their own kind of brand in my district as well, and so kind of their own culture too. But we're all also like a pocket of Northeast Summit County too. So there's a lot of similarities between us. But yeah, I mean, it's this district, like yours, was, you know, drawn purposely. And my daughter's doing piano in the background, so you're just gonna hear, you might hear a little bit of that.
We can all
we'll take it. It was, you know, I have a gerrymandered district. I have a slice of Cuyahoga Falls, and it was drawn up in a hotel room in 2010, you know, to be essentially safe for Republicans. And so, but we flipped it in 2018. I'm the first Democrat to be in this district. Yeah. What's in post gerrymandering in its current shape? Yes, wow. There was one person one time in a previous iteration of it, but what we have seen, and I guess the little gerrymandered slice of Cuyahoga Falls is so interesting to talk about, because that was gerrymandered in to be a red part. And I ended up winning that little slice of Cuyahoga Falls because it's emblematic of what's happening in suburban districts, which they've become much more, they've trended bluer, they've become much more competitive. And if you look where those flip districts happen, they were all in those suburban, smaller cities anchored by big city kind of districts. So, that's kind of, it sounds like we're pretty similar in that regard.
Yep, absolutely. That's what we see happening over here as well.
All right. Well, Monique, I know you have some questions about healthcare and some other things, so I'm going to go ahead and turn it over to you, and I'll join you back when we have questions. So I just want to encourage everybody out there, type your questions in, and we will try to address those as time allows at the end of the session.
All right, that sounds good. Thank you, Carolyn. Well, Casey, I wanted to, first of all, let me just say, so for you as a sitting state rep, you are finishing your first term, is that right?
Yeah.
And you're up for re-election just like everyone in the state house right now, right?
Oh, Lordy, yes, I have. I'm doing the rep thing because I'm on this select committee for the House Bill 6 situation. So I'm schlepping down to Columbus regularly for that. So I'm very much doing the rep job and re-election too, with the young kid situation and another day job as well. So it's a lot every day, but it is amazing and never a dull moment. That's for sure.
Absolutely. And you, by the way, just a fun fact about you, you choose to make the drive every single night and not stay overnight generally in Columbus. Is that right?
Yeah, it just, for me to be able to get back when I can to tuck the kids in or to be there in the mornings to help get them on the bus and get them to school, that's worth it for me. And so it is 2 hours each way. But, over time, it kind of goes faster and faster, I'd say, because, I try to spend the time just decompressing a little bit, maybe making a couple phone calls on Bluetooth just to catch up with some folks while I've got some of that time. And then it's just important for me to try to be here for my kids as much as possible. And my wife, who's got her own, whole career going on too, and needs me to do my part too. So
that's great. Well, I think that's a great example for some of us who also have young kids at home to be able to know that there is a way to do it, and we don't have to sacrifice one for the other. Serving in Columbus in this capacity doesn't have to mean totally abandoning your family, and you can find that balance if you get creative.
You definitely can. There's room to do it, and there's flexibility to do it, and it's maybe a little bit more road time, but it's these trade-offs to be back with the family as much as possible is a great thing. So.
And before we talk about healthcare, one more thing. So, and you're an electric car driver. So have you found that it takes like one good charge, one full charge, or how?
It's a very good question. And be careful, Monique, because you're tapping into a deep well of enthusiasm that I have for electric vehicles. But yes, I do drive an electric vehicle, and it's a Tesla, and there's a network of chargers up and down the road. So I can get down to Columbus on a 90% charge, which is where you kind of do your day in and day out driving, down to Columbus and then back up about a third of the way to a supercharger that's right by a McDonald's. So I charge up for 10 minutes, I grab a like a chicken sandwich or something like that, come back, and then I head back up from there. It's like a little routine that I'm into at this point.
That's a nice, so you don't have to feel guilt about burning gas and carbon footprint and all that stuff when you do all your driving.
When I little plug here, pun intended. When I started, I had an SUV, and it was a hybrid SUV, but I was going back and forth so much to Columbus. It was like hundreds of dollars, $400 a month, and in gas, and in charging, it's probably $20 a month, 20 to 30. So when you're elected and you're driving down, I mean, it's something you should definitely consider joining the EV club.
More role modeling for me. I appreciate it.
There you go.
So what we're doing on the campaign right now is focusing our our posts on social media and our conversations on the question of healthcare right now. And of course, as we continue to struggle through the pandemic as a state and as a country, COVID is at the top of everyone's minds. There were already so many cracks in the healthcare system to begin with, and so many things for us to work on. But I'm going to go ahead and just jump straight to COVID right now, and tell me some of the things that are top of mind for you as we struggle through this specific healthcare crisis at the moment.
Well, of course, your mind goes right to PPE and, giving people everyone's dealing with this additional expense and the new challenge of whether it's operating a business or a school or a hospital or whatever the case might be. Everyone's dealing with a new economic reality for how that works. And part of that is the cost that they have to bear to keep people safe, right? And so PPE in all its forms is something that that's always top of mind. We're doing distributions right now in my district, working with the chambers of commerce to get those supplies in the right hands. So that's important, and that's been a continual challenge. But the fundamental concern that you have is just access to care for people and having people in the system, and you realize the absolute criticality of having people with primary care and prevention and early intervention, and folks that know where to go when they are sick, how to get tested, where to get tested, who to talk to have a doctor as a resource to consult. And you just see how vulnerable we were as a country with those cracks that you mentioned, Monique, about, in care, and that people fall through. So just fundamentally, it is such an incredibly important issue that we have to keep working on and have to keep pushing on. And I mean, this has just exposed it, I think, in a major way.
Right. What do you think we've done well, and what do you think we could do better as a state? And just at a high level. Yeah.
Well, I think we were early to act, and credit where credit's due with Governor DeWine. And again, apologize for the 6-year-old yelling in the background.
It's okay. Really
I know I don't have to apologize to you. I know that. I'll just explain it.
Okay.
So, Dr. Acton obviously was amazing. We were really fortunate to have a world-class public health official and a governor who listened to her recommendations. And so early on, we had a pretty strong intervention. And I think, even the legislature early on was taking it pretty seriously and made some substantive moves from a legislative perspective to help the state accommodate things. And then it's kind of gradually, unfortunately, unraveled, I think, in a lot of ways, where you've got folks in the House who, they don't wear masks. The vast majority of the Republican caucus, they question, it's like become a freedom argument, an us versus them argument, a very political argument. They basically are undermining the really strong start we had on this thing. So we've lost a lot of momentum, and it's been, I think our leader, Amelia Sykes, put out a post today saying it's been like 150 days since we've done anything substantive from a legislative perspective to help specific to COVID, even though there's so much to do. So I feel like lately we're falling out and we're not doing our job. We should have been in session this week getting things done, but sessions were called off this week. And now we were trying to sync up with the Senate, but the number 2 senator got COVID, and the Senate Majority Leader, or the Senate President, is quarantining. So I don't know when we're going to be back at it, but we've lost our mojo when it comes to staying ahead of this thing.
Right. And I think, when we were all united and on the same page and following the same script in terms of trying to slow the spread of COVID and isolate and stay home and all those things, we saw such progress, like you said early on. And now this idea of like kind of every person for himself in terms of no longer thinking about protecting other people in your own house chamber there is just so disappointing. And I think you start to feel all the chaos that surrounds that kind of approach, that I'll do whatever I want approach, instead of thinking of the big picture and thinking about how my actions are affecting other people's.
Yeah, like, I mean, we're a country for sure founded with a deep, root of freedom and liberty. Like we love our freedom and liberty, but we're also a country that has borne, shared sacrifice, and we've helped each other out. And I think it's a small sacrifice to wear a mask and to maintain a social distance and to try and do our best to help others out by not spreading COVID-19 around. So, that's where I try to emphasize, is to say, hey guys, yep. And the phone's ringing and it's just chaos in my house as usual. It's just, let's emphasize there's a balance in these things, right? We have freedom and liberty. We can also do a little bit of sacrifice for each other.
Yeah, I love that. And you say that as a person who has served in the military. So you've probably had lots of opportunities to think about sacrifice and working with the team and looking out for everybody else for the greater good.
Yeah, my family, my grandpa, both grandpas served, and my father did too. And I met my wife at the U.S. Air Force Academy in the cadet gym when a TV fell on me, and she rescued me and locked the power dynamic in for our relationship right there. Let me tell you. And that's actually what brought us to Ohio. Is we were both assigned to Wright-Patterson Air Force Base. So, and then we chose to stay from there. So certainly, yeah, like we're used to being told where to live and what job to do, and living under the Uniform Code of Military Justice, which is an entire layer of law above and beyond, normal law. And so, we're kind of like, yeah, guys, let's pull it together, a little bit of shared sacrifice here, and we can get through this thing.
Right. So that is the current crisis that, everybody's always thinking about and worrying about, and it's affecting our school year and all that stuff. But I want to talk to you about another healthcare issue that you worked on, and that is working to pass Madeline's Law, which provides, I guess, protections for families in terms of pricing and access to hearing aids. Is that right? Can you tell me more about that so that I don't butcher this any further?
Yeah, no, it shocks a lot of people to know that hearing aids are not mandated to be covered by insurers for most Ohioans. There are some plans which are federally backed, which do have some minimal coverage for them, but for the majority of Ohioans, there's no coverage for hearing aids. So we call this bill both Madeline's Law, because there's a young lady named Madeline who is 7 years old and who has 50% hearing loss, genetic hearing loss, and will have to have hearing aids, for potentially for the rest of her life. But as a child, every few years as you grow, you have to have these replaced, and it's quite expensive. And so her parents are both teachers, but I mean, even, and they do okay, solid middle class family, but this is still a financial burden for them. And you just think about folks who maybe aren't as lucky to both be fully employed or have, steady income. It's even more of a burden, and it just shouldn't be. Children have a right to hear. And so we set about, actually, it was kind of interesting. Allison Russo is my joint sponsor on this bill. She's a terrific representative from new one like me from Franklin County. And we both had town halls where this issue came up at the same time, and then kind of decided to work together on it. But we were able to make it a bipartisan bill. We've got, we had a series of bipartisan freshman bus tours where we brought our fellow freshmen into our district. We toured theirs, we spent the day together, and over the course of those days, lobbied the heck out of them to get on the bill. And we got several Republicans to jump on, which was a great thing. So it is a bipartisan bill. It's going through the health committee right now. It's on its third hearing. And we're doing our best to try to push it through and make this law. It's an insurance mandate, which I guess I didn't know there was like a gentleman's agreement not to do any more insurance mandates after like an autism expansion 10 years ago, which was a great thing. And then everyone's like, no more, let's not piss off the Chamber of Commerce or small business or NFIB, who generally lobby against these things. And I was kind of like, well, no, that I wasn't part of that agreement. We're going to try and do what's right for the kids. And the financial impact, Georgia and Kentucky just did it. And the financial impact was from 0 to 8 cents per insured person per month. And so we felt that was a reasonable, thing to ask insurers and folks to help to make sure kids have a right to hear. So we're working on it.
That's great. Well, I wish you luck in passing that. That's exactly the kind of thing that I feel like our legislators should be working on, and helping to make of course children's lives better, and to make Ohioans' lives just better and healthier. And I don't think that we should, it's unfortunate that we sort of have to explain why we're doing that, and asking for just a little bit more from really large insurance companies. So kudos to you for pushing forward on that.
Thanks, Monique. And I got to say, there's an amazing community, amazing network of supporters of this out there who have worked really hard to help get this thing moving too. And it's been one of the joys of my first term, getting to be plugged into this community of folks in audiology and in the hearing impaired community, and it's just been fantastic to be able to get to know them and learn more about this and to advocate for them too.
This is such a great story and such a great example of how how a representative can listen to the real world needs of what's going on in the district and do something to help people's lives. And I think voters and constituents in our districts would sure love to see a lot more of that. So it's a great story to hear about, and I hope it's successful. I wanted to, well, we kind of, I've realized as I've been watching other people's videos, as we're all trying to figure out how to communicate with each other at the time of COVID, I'm realizing more and more that people have short attention spans. So we're not going to make this a super long conversation. We're actually going to start wrapping up pretty soon here. But it's been really great getting to hear what kind of work you do, and especially how much impact you can have as a freshman, first term state representative. And I really do look to you as one of the many role models in the House of Representatives, getting in there right away and using so much of your energy and enthusiasm and optimism, and also an attitude of respect and just a willingness to work with people to get things done. Again, that's something that I think so many people just want to see more of in government. And I do think that you are just a great example of that, Casey. So I love watching.
Thanks, Monique. And I just want to say it can be done. I mean, we've come together in a bipartisan way to do, a huge investment in clean water through the H2 Ohio program for the Lake Erie watershed, which my district is in, and I know yours is in too. Transportation, public transportation, and a huge down payment. We did an infrastructure bill, which is pretty cool. A lot of people talk about infrastructure bills. We did an infrastructure bill. We raised public teacher pay. We increased funding to public schools. We increased funds for college opportunity grants. I had a bipartisan amendment in the budget to increase security for vulnerable nonprofit institutions to harden against potential mass shootings, which is a sad thing that we have to do, but I'm glad we could come together in a bipartisan way to do it. And I had a bill for military families as well. So we've come together. There are pathways to do that, and it's just about focusing on that common ground. And I've seen the campaign you're running, and I know what you're all about, and I know that's exactly how you're going to serve when you're in the House with me. So I look forward very much to working with you and doing great things together.
Oh my gosh! Well, thank you so much for that. We're working hard over here, and I hope I have the chance to get down there to Columbus and get to work as well. Before we close up, I want to ask you just about the experience. We can hear all the excitement and activity going on in your house because you have young children. And like you said, you have a day job and everybody has busy lives. Just share with us from your personal perspective as someone who is juggling so much, how would you describe the experience of being a parent during COVID? And what are, I don't know, do you feel, especially if you have children who are not able to do their normal activities, I would love to just have you share and sort of have us all relate to, there's one of those little kids. Hi.
This is Nora. Do you want to say hi? What grade are you in? First grade. That's Monique. She's running to be a state representative. Is that cool? Yeah. Do you think she'd do a good job? Yeah, I do too. Okay. I'm just going to help her finish up her town hall and then I'll be right with you. Okay. Okay. I'll be right with you. Oh, she has to whisper me something. Halloween decorations? She wants to do Halloween decorations. I'll talk to you.
My kids usually want to do them in July, and especially at the younger they were, the earlier they wanted to start doing them. So I can relate to that. And I like that I'm endorsed by Nora. I'm going to add that to
Hey, I mean, as a candidate, we take all the support we can get. Let's be real. So parenting during COVID, doing all this during COVID, I'd say one day at a time for sure. And just very thankful for having awesome partner in Amanda and two really great kids. And we have our in-laws close by who, after the initial quarantine phase, have been really great and supportive and helpful. And we have amazing friends who've helped, who help support as well. And, I'd say it's just, forget every day. I guess it's one meal at a time. That's the way I kind of think about it. Like, let's get to breakfast. What do we got? We got a lot coming at us. Let's tackle this. Let's get to lunch. I don't know if you use like a shared family calendar on your phones. I don't know what I would do without our shared family calendar. And, I just kind of like do what the calendar tells me to do. And we knock it out one meal at a time. And we just got done. We were a little delayed tonight because of me. I want everyone to know that, because we were just wrapping up dinner and getting that squared away. So that's kind of how it's been. But, ultimately, like, I cannot complain personally. We're healthy. We're okay. We're happy. And, lucky enough to be okay financially. So we're doing fine, and we're focusing our efforts on trying to help those who aren't as fortunate, or, maybe on the front lines of this thing, and just doing as much as we possibly can to serve and support them and thank them for what they're doing and to help ultimately. So that's been okay. A lot of Disney Plus too. A lot of Disney Plus. When that sign up day came, that was one thing we were like, what, take my money. Just take it and just,
right. And they added Hamilton, so it was like a lock.
It was an absolute lock. And so that's been a bit of a saver too. Let's be real. They've logged some Disney Plus time. Some
iPads, maybe some whatever the electronics are that your children have. They probably logged some good time since March of 2020.
Not gonna lie, they've logged some time. And so, but we're getting through it. We're getting through it.
Okay, good. So, well, thank you so much again. I love hearing about how you juggle it all. And I think so many people can relate. Just this idea of having work responsibilities, having home responsibilities, having community, service responsibilities. Doesn't matter what scale it is. And interacting, like you said, interacting with your extended family and doing it in a safe way. And I love it when folks are willing to just stop for a minute and all relate to each other and realize we're all in the same boat. And that's actually a perfect segue to go back to my friend Carolyn, who is a working mom and who has a daughter who, just like mine, is doing homeschool for quite a while we get through this pandemic. And so, Carolyn, I'm going to throw it back to you and we'll have you help wrap it all up.
Sure. Well, we did get a few comments and questions that I wanted to share. while you were talking. So thank you for that great discussion. I think that we have about 3 watch parties happening. So thank you everybody out on Facebook who's been watching as well. So one of our watchers, Megan, commented when you were talking about Madeline's Law about how she says, I'm sure there are so many other needs like that. And, my grandma, I remember, commented to me, she goes, well, with Medicare, I can live forever, but I can't see, I can't hear, and I can't walk because her glasses weren't covered, her hearing aids weren't covered, and she had a specific walker she wanted. So, there are those gaps. So thank you for going out there and fighting for that. I think that's amazing. But Misty wanted to know if you could just talk a little bit about Medicaid expansion in Ohio.
With Monique or me?
Let's start with whoever wants to talk.
Okay. Well, Monique, I'm going to defer to you, and then I'm happy to chime in, but I want to give you first crack at it.
Well, I mean, you talked about the importance of preventative care and early intervention and basic testing and having places where people know they can always go and always be seen by healthcare providers. So, though Medicaid only applies to a certain income level, I think that there are some, in recent years, I've really become more and more interested in the idea of having possibly like Medicare for More or some kind of expansion of more community-based healthcare facilities and resources that we all know we can go to no matter what our employment status is, no matter what our income level is. And that's good for all of us in terms of preventing the spread of, even basic, we hear that people walk into ERs with a common cold or, with a nasty, with a bout of the flu or something like that. I just would love to see us work on finding budget dollars and changing our priorities a bit to help more with public health and prevention. And then for me, another thing that I care very much about is mental health care. And so I was glad to see that during this time of being sort of isolated at home, that we expanded telehealth so that people can continue to get that kind of care remotely. So anything we can do from a policy perspective to allow care to be given in more ways that are affordable and just available no matter where you live is all, what I would want to do some more work on. And of course, there's a cost to everything, but I do think sometimes it's a matter of cost and benefits. And if the benefit is that we have a healthier population and people are more able to be self-sufficient and continue to go to work and continue to live their lives actively, then I think that it's worth taking a look at our priorities in those areas.
You nailed it. I think we're lucky that we did get Medicaid expansion in this state, and that we should not take it for granted. And we need all the healthcare, access to healthcare representatives that we can get in Columbus to help protect it. That's what I'd say, is it's vulnerable to being repealed. And so, come join us, Monique, because I agree with every word you said.
All right, go team, let's do it. We only have, how many more days? Are we at 48 now until election day?
Oh, do tell me.
I don't know. So we're getting close. So everybody, don't forget, Election Day is November 3rd. Early voting starts October 6th. I keep mixing the 3 and the 6. October 6th, get your, you can start early voting through the mail. You can request your ballot online now. We strongly recommend that you do that, knowing that the U.S. Postal Service is going to be very, very busy with lots of people voting through the mail for a number of reasons, but mostly to help to stop the spread of COVID and to stay home as much as possible. So join in that effort. Go ahead and request your ballot online now. If you live in Cuyahoga County, in my district, you just go to the Cuyahoga County Board of Elections website, and you can find a place to get your ballot request. They will just send you what you need, and you can drop it in the mail. And day by day, we're hearing new information on possibly even having more secure Board of Elections drop boxes and drop locations added. So that's great, great, great news for all of us voters. You might not even have to end up going through the mail service. So just stay aware of that. But we do encourage everyone to vote through the mail, vote early. Get it done before Election Day. Election Day turnout is going to be so high. It's going to be so busy. You don't want to be standing in a long line with a mask on at the Board of Elections. You want to get that done. Do it from home in your pajama pants. I highly recommend it. You can also, it's like an open book test when you do it at home, because you can look up everybody that you want to look up online as you're going down your ballot. And it's just the best way to vote. So we're getting close. And I appreciate everybody's just attention to what's going on politically. And I appreciate everyone's support for this campaign. Keep an eye on Casey Weinstein. He's always doing good things for the environment. He's always doing really bipartisan work, and especially helping veterans and military families. And I hope that you'll also check out my website for updates when I have new endorsements. Those go there. If I haven't said it enough times before, I am endorsed by President Obama himself on his first slate of 2020 endorsements. And so just super proud of that, as well as U.S. Senator Sherrod Brown, and more recently, Congresswoman Marcy Kaptur, and a number of organizations that support families.
Man, all right. The only thing better than Barack is Michelle. Okay, and nobody gets Michelle for endorse. So you did. You're there. You're right there.
I have long said Michelle's my favorite.
That is amazing, Monique. Congratulations. And I'm sorry to interject. You were on a roll, but I'm just so excited watching your campaign. You're working so hard, and I'm so grateful that you're stepping up to do this. So I just had to say that. I'm sorry.
Yeah, absolutely. And I hope I get the chance to work with you. So thank you, everybody. Keep following along on Facebook, on Twitter. Stay informed. Again, as we get closer to Election Day, lots of things could change as far as, how ballots can be cast and when and where. But again, do it through the mail, do it early so that you can avoid all those things. And if you have any questions, there's contact information for me and for my campaign on my website. And we always welcome any questions you have there. So Carolyn, I think that's everything we can cover in less than an hour.
It is. And thank you, Monique, because I was going to encourage everybody to do both of those things, to make that plan for voting and to go out and make sure that you like both Monique's Facebook page and check out our website, and then like Representative Weinstein's page as well, so that you can keep up to date on all of the thoughts that are happening right now. So if you enjoyed this discussion, please make sure that you join us and like all those pages, and you can help us as we move towards this election. Tell your friends and family, and thank you so much for joining us. We hope to see you at our next Tuesday talk.
Thank you, ladies. Good night,
Bye-bye.
everybody.
Good night.